Thupirim nahan lungfi chong ka go along Dr. Mongfing Lepcha Tudosa Dongbril Thakpi Plongka Putong Mat Bunong Lino Labden Puding Mo.
Good morning to one and all. Gunlen nahan avi chenlat bugan ren reni dom go Mongfing Rong Dom Saro Kamri. Thank you for having me here today. It's a great honor and privilege for me to be here, for which I would like to extend my gratitude to the Tendong Lorumfat Organizing Committee as well as Tendong Knowledge Series Committee. I would also like to take this opportunity to thank all my research participants for contributing in my research and letting this research happen. And I would also like to take this opportunity to thank Honorable Minister Ren Lupan Pinsonamgel for giving me an opportunity to be a part of one of the prestigious projects which is being conducted in Sikkim, which is on Ru Suom, the documentation of Ru Suom, which is a Lepcha cane bridge, and also the recognition of Lepcha cane bridge. So, as PhD is a very long journey of at least 4 to 5 years, it is not possible for me to, deliver each and everything. But one of the prominent anthropologists, Professor T.B. Subba, once said that if you cannot, explain your research in 5 minutes, you will find it very hard to even explain that within 1 hour or 2 hours. So I'll just try my best to explain my research journey the research journey. They say that every generation faces different kind of challenges, and my research topic is also one of, it focuses on one of the challenges which is being faced by the world at present. So, with due permission of the House, I would like to start off with my presentation. So the topic of my research thesis was a comparative study of differential fertility and mortality among the Lepchas of Sikkim. And my research I completed my research from Department of Anthropology, Sikkim University, under the guidance of Professor K.R. Ramamohan. So for the introduction, I would just like to give a brief introduction of why this study on fertility and mortality is being taken. So fertility, the study of fertility is usually done to analyze the population by demographers. And there are different parameters like fertility, mortality, and migration, which is used and statistically analyzed. Fertility can be defined as the physiological ability to have children or to reproduce. And how fertility is measured is by using the fertility rate. And how do we know that fertility rate is decreasing or increasing is there is a replacement level, that is a replacement level of 2.1, looking at which we analyze whether the fertility of a population is decreasing or increasing. So can anyone say what is the fertility rate of Sikkim right now? It is 1.1. So we can see that the fertility rate of Sikkim is below replacement level. That is, in order to be a certain population at a stable population, you need to have at least 2 children per couple. So we are even, lacking behind that. And mortality rate is the ratio of total number of deaths to the total population within a specific time frame. Here I have basically looked into the infant mortality rate, which is the number of deaths of infant under 1 year old per 1,000 live births. So now the mortality rate of Sikkim is 11 per 1,000 live births. So whenever we, choose a research topic, there is always a question that why the researcher or why we are taking up this research. So the reason for me to take up this research is globally, as we all know, that population is being seriously affected by declining fertility. On one hand, infant mortality rate has decreased, but on the other hand, declining fertility rate is posing serious threat to the world's population. So like I said, that when fertility rate is declined, there will obviously be a shrinking population, that is declining population. And when the population is declined, what happens is, aging population is increased. And when aging population is increased, the dependency ratio also increases. That is, the dependency ratio of infant and elderly people on the working population also increases. And if you look into vulnerable communities or minority communities, the decrease in fertility rate impacts greatly on marginalization, loss of cultural transmission, traditional knowledge, language, economic disparities, limited access to resources, etc. So in Sikkim, studies on fertility rate and mortality rate have remained almost neglected. As Lepchas are particularly vulnerable tribe in Sikkim, their population study is vital in order to keep track of their population as well as to understand the factors which are responsible for affecting their population. So these are the objectives of my study. So in materials and methods, and my thesis, I had given all the information regarding what are the materials and methods I had used to conduct the research, and what are the sampling methods which were used, and in which area I conducted my research. So the research basically focuses on the urban and rural population. So for rural population, I had done my ethnographic research on villages like Kala, Nampatang, Tingwong village, at Mangan district, Bulung, Gamgyap, Tek, Namchi, and on urban population, I collected data from urban Upper Burtuk, Lower Burtuk development area, Upper Sechia, Lower Sechia, etc. So for the budding researchers, I would like to just inform that ethnographic research, though it sounds very interesting, because you have to go to the field, you have to stay with the people and study, but when it comes to urban population, specifically when it comes to population like us, the Lepcha population, which are really sparsely populated in the urban areas and very limited in number, it's very difficult. So you have to be, if you are planning to take up studies on the urban population, you have to be very mentally prepared. So all the data which I had collected were statistically analyzed, and the parameters which I had taken were suggested by the World Health Organization. So the third chapter of my thesis consists of results where I have statistically analyzed different factors like socioeconomic factors, cultural factors, and biological factors, and I calculated that whether the impact of education or the different factors, so to say, how they are impacting the fertility rate in urban areas as well as in the rural areas. So I'll not explain the tables yet, I'll just show you some of the tables. There are almost 50 to 60 tables which are statistically analyzed. So after conducting all the research and statistically analyzing the data, what I found out was, these are some of the findings. So I'll just explain a little bit and I'll just go to the conclusion. So women in rural areas have higher number of conception as compared to rural in urban areas, which was due to early marriage and longer reproductive span among the women in rural areas as compared to women in urban areas. The use of contraceptive and sterilization were prevalent in rural areas than in urban areas, as women in rural areas marry early. and have longer reproductive span, which allows them to have a greater number of children if desired, but because of their poor socioeconomic condition, they are assisted and encouraged to opt for birth control methods through various health and nutritional schemes and healthcare assistance. In urban areas, late marriages reduces reproductive span, due to which oftentimes women do not feel the need to opt for such methods. From the present study, it was also found that mean live births were high in rural areas, but mean surviving children were similar among Lepcha women in rural areas and urban areas, because even if the live births were high in rural areas, but the reproductive wastages were also high as compared to the urban areas. In urban areas, women were more aware of their healthcare, affluency, and accessibility to advanced medical care, hence the survival rate was higher even if the birth rate was low. Occupation is yet another factor that affects fertility as well as mortality. Among the Lepcha population of rural areas, mean reproductive wastages were found more among women who were unemployed, which was also linked to less education, more heavy-duty household chores, early age at marriage, and age at first childbirth, hence longer reproductive span, more number of conception, hence more number of reproductive wastages. In urban areas, due to work stress, delay in marriages, and shift in lifestyles were adding towards prevalence of miscarriages among the unemployed Lepcha women. In the present study, it was also found that among the Lepcha women of rural areas, mean live births and mean surviving children were high among middle income age group, whereas in urban areas, highest mean live births were mean live births and surviving children were more among low income group. Among the Lepcha population, the prevalence of women marrying at early ages was more in rural areas than in urban areas, but educated women in both rural and urban areas were marrying late because of focusing on their career building. The study further indicated that even age at first childbirth has a strong impact on the Lepcha population and provides the fact that Lepcha women in both rural and urban areas whose age at first childbirth was 20 years or below have longer reproductive span, hence more number of children. Now, the impact of healthcare facility and assistance of the local caregivers. In this, I found out through the research work that the prevalence of healthcare centers visits during pregnancy and at the time of delivery of the child were mostly among the Lepcha women under high income group in both rural and urban areas, because families who were economically sound were able to bear the expenses of healthcare, which otherwise poor families would have just relied on local healthcare givers or ignored only for worse consequences. In terms of occupation, the prevalence of healthcare center visits were most among unemployed women in rural areas and more prevalent among employed women in the urban areas. Women in rural areas were mostly unemployed and under low income group, which was the reason why they were assisted by local caregivers, whereas in urban areas, women were more self-aware, economically self-reliant, and took extra precautions during pregnancy as they were aware of their crucial reproductive phase and that their reproductive span is less. So there were other findings as well, important findings, and the researcher or anyone who's interested to know more about this research can contact me, or you can just Google the research on fertility and mortality among the Lepcha population. You will just find out different papers as well as my research thesis as well. And if you have further inquiry like how you can fill up the gaps of this research, you can just contact me or email me. So for the summary and conclusion of my thesis, the current study of rural and urban Lepcha population in Sikkim was an attempt to assess the fertility and mortality of the Lepcha population and analyze the influence of different factors related to it. The study revealed that the fertility rate is low among urban population as compared to the rural population, and various factors such as education, occupation, income, age at marriage, age at first childbirth, and use of contraceptive and sterilization were the causative factors which affected the fertility and infant mortality among the Lepcha population at different levels in rural and urban areas. Lepcha women who were educated and employed are having late marriages and late childbirth, whereas in rural areas, prevalence of early marriages and early childbirth were found among among women who are less educated and unemployed. The study revealed that educated women in both rural and urban areas are more aware about the maternal and childcare health. Further, the study also found that the reproductive wastages are more among women in rural areas who are among low-income groups and unemployed women, yet use of contraceptive and sterilization is also prevalent among women in rural areas than in urban areas. So from the present study, it was also found that the impact of ASHA, Anganwadi workers, and ANMs were very essential and actively well-functioned, especially in rural areas, because the information and awareness on maternal and child health care, institutional delivery, and nutrition of mother and child were provided by them. Health of expecting mothers in rural areas were timely monitored for the safety of both mother and child. As a result, among the Lepchas of Sikkim, the socioeconomic, biological, cultural, and healthcare awareness and accessibility have influenced fertility and infant mortality. Now, the future prospects of this research is, though this research is first of its kind and there may be a lot of loopholes, so I request the budding researcher to just continue with this research and can add on more to it to make it more meaningful and help the policymakers to refer to this, to initiate different policies on how we can keep track on fertility as well as mortality, not just of the Lepcha population, but of different population as well. So, and future prospect of this research is fertility and mortality, as well as the factors that influence the duo should be studied continuously in order to understand the population trend of community, state, or nation. At present, Sikkim is experiencing a decrease in fertility rate, which is why the present government is formulating different schemes to encourage having a greater number of children. The policy makers may refer to this research and use it to inform their decisions. During the current study, it was discovered that some respondents in rural areas were not keen with the use of contraceptions and sterilization, despite the fact that most women and even men were encouraged to choose family planning measures. Because of the decreasing population, what I found in some of the Lepcha villages in Sikkim was that they were not happy with the government schemes which were first focusing on having low number of children. So this has had an effect on their population growth. As a result, community-based ethnographic research can accurately reflect the status of policies developed by concerned authorities at the community level. The researcher recommends conducting more community-based fertility and mortality studies. Fertility and mortality are important aspects of public health, more so that with the dwindling Lepcha population in Sikkim. The different agencies like NGO, Lepcha community welfare organizations, healthcare department officials must have a coordinated effort in sensitizing and bringing more awareness towards reproductive health behavior among the minority Lepcha population in Sikkim. There is an urgent need in addressing this public health issue for the Lepcha population in days to come. Tokchi Yatim. Thank you.